Hello, everyone. Our textbook in Chapter 5 discusses several social welfare services. All of these services are needed, and I work every day with people in need of these different types of services. As far as the most needed services that I would like to talk about are access to health care, especially health care for the uninsured and housing. Housing is also a big problem. These are two problem areas that I have to deal with regularly when working with my clients. And I have people who are uninsured and unhoused often at the same time. Getting these people connected to their providers, healthcare providers, is extremely challenging at times. The conclusion in chapter 5 of our text talks about 5 common problems that are encountered by rural social workers, agencies, and communities. I want to start with a combination of the first and the second one that are mentioned at the end of the chapter there, which is access to service and availability of specialized services. So here's a little example of both of these problems. So there's a person who needs to see a gastroenterologist. The organization that arranges for this kind of specialty care for uninsured has two different GI doctors that are available who will volunteer their time um, for uninsured patients. And these appointments are very difficult to get and sometimes take months for people to be seen. So both of these doctors are close to an hour away from where the patient lives, and one of these doctors is across the state line. Now, let's say that patient doesn't have transportation, so local transportation services don't usually cross the state lines. The exception is if a patient has certain types of insurance that has a contract that allows for that, but that's not the case in this situation as this person is uninsured. And so that's not an option. So thankfully, there is an organization that has approved the cost of a cab for this patient to go to this appointment, which is almost an hour away. I don't know the exact cost that it's going to be. I would estimate between $150 and $200 for this person to take a cab there. So this person could not afford that without the help of this external organization who's covering that cost. And so that's a big deal. So you can see how that's a barrier or an example of a barrier to healthcare services when someone needs that kind of specialty service, actually getting the appointment, finding a doctor who will volunteer their time for an uninsured patient, and then the challenges of even getting them physically to an appointment that's almost an hour away. So the second thing that I'd like to talk about is housing. And housing is also another very difficult barrier for a lot of the people that I work with. It's finding housing that's affordable is so difficult. And our textbook states that from an article in 2013, sorry, that 29.6% of the housing units in rural and small towns is inadequate. So public housing where we live has a wait list of 1 to 2 years, and that's if the client can get all their needed documentation together, get it turned in a timely manner, and don't have to start all over again. I know of someone in a rural area and the housing authority lost their application, so they had to completely start all over again. So some of those things are super challenging. And if the client has any type of felony charges, housing is even more difficult to find because lots of people won't allow uh, those with criminal backgrounds to live in their developments. And so I know of people who have worked full time in lower paying jobs, such as fast food jobs, things like that, and have spent almost entire paychecks for a month to stay in hotels just so that they would have a roof over their head. Um, so this is hard and frustrating and difficult for those who are trying to make a fresh start, maybe have a criminal history, want their own housing, but have lots of barriers against them to get that housing. So thank you all. Have a good night.